wash my hands. Hello, my name is Madeline Brandt. I'll be your physician assistant student today.
I'm Sam.
Can I get your name and date of birth, please?
Sam and April 7th, 2001.
Perfect. Last name too, actually, if that's okay.
Brandt.
Perfect. Okay, I'm gonna, my patient appears pleasant, cooperative, and is answering my questions appropriately. He appears to have good hygiene and he's dressed appropriately. I'm going to begin my head exam by noting that his head appears normocephalic. I'm going to examine his skull, scalp, and hair for any signs of obvious trauma, deformities, crepitus, discoloration, point tenderness, alopecia, nits, or louse. I don't know any of that. I will then proceed with my eye exam. I'm going to check my patient's visual acuity using the Snellen chart. Go ahead and hold that about a foot away, or go ahead and check your one eye. There you go. Check your first eye. Go ahead and read the lowest line that you can.
3, 7, 2, 8, 4, 6.
Good, and then go and cover the other eye. Do the same.
6, 8, 3, 2, 7, 9.
Okay, and both eyes together.
3, 7, 2, 8, 4, 6.
Okay. And then I will palpate my patient's orbital bones. I'll palpate his eyebrows and lacrimal glands. I'm going to inspect his eyelids and evert them if I note any foreign bodies in the eyes. I'm going to inspect his iris and conjunctiva for any redness or abnormalities. And then I'm going to assess my patient's 6 extraocular movements. Go ahead and follow my finger. Okay. And then I'm going to use a pen light or my ophthalmoscope in this case to inspect my patient's cornea and conjunctiva. And I'm also going to assess his pupillary reaction to light both directly and indirectly. Okay. Good. And I'm going to assess my patient for accommodation. Go ahead and follow my finger in, okay? Okay, and then I'm going to proceed with my fundoscopic exam. I'm going to position my patient using my left eye. I'm going to be looking at his left eye first. Go ahead and look at my ear as I do this, or at the wall if that's easier as well. I'm going to look for the red reflex. I'm going to look for the ophthalmic disc, or the optic disc, and then I'm going to have my patient look into the light in an effort to visualize the macula. I'm going to do the same on the other eye. And I should have dimmed the lights, but I did not. Okay. Following that, I'm going to proceed with my my ear exam. I'm going to first inspect my patient's external ear, the auricle and the pinna. Okay. I'm then going to use my otoscope and speculum. I'm going to position my patient's head appropriately. By pulling up and back on the auricle, I'm going to stabilize my hand using 3 points of contact against my patient's head, and I'm going to insert the speculum. I'm going to note the external canal if there's any obstruction, exudate, or erythema. I'm going to look for the cone of light and look for any meningotomy tubes. And I'm going to note that the tympanic membrane appears patent and there's no bulging or erythema. I'll do the same on this side. Okay. Okay, and that for that exam. I'm going to proceed with the nasal exam, but actually I'm going to put this back on. I'm going to ask my patient to go ahead and cover one nostril and breathe out, and then the other nostril. I'm going to use my otoscope and speculum to inspect the internal nasal canal. Go ahead and lean your head back for me. Sorry, I'm actually supposed to. Okay. And then I'm going to palpate my patient's frontal and maxillary sinuses and tell me if you have any tenderness. No? Okay. I'll then proceed to the mouth and pharynx exam. I'm going to inspect my patient's lips. I'm going to inspect his oral mucosa. Go ahead and open your mouth for me. Okay. I'm going to inspect his hard palate. I'm going to ask my patient to go and show me his teeth and gums. Okay. I'm going to ask my patient to show me his tongue and go ahead and stick out your tongue and show me the floor of your mouth. There you go. Perfect. And I'm going to palpate my patient's tongue using a glove. And then I'm going to also inspect my patient's pharynx. Go ahead and open your mouth. And then go ahead and say so I can inspect that the uvula is midline. Good. Okay, then I'll proceed with my neck exam. I'm going to begin by inspecting my patient's trachea and noting its position and any abnormalities. I'm going to inspect his thyroid gland for enlargement or asymmetry. I'm going to go ahead and palpate the thyroid gland and ask my patient to swallow. Okay, good. I'm going to then palpate each of the lymph nodes, starting at the preauricular, posterior auricular, occipital, tonsillar, submandibular, submental, and then the anterior cervical, posterior cervical, and then the supraclavicular. Okay, and then I'm going to proceed with my cardiovascular exam. So if my patient can go ahead and remove his shirt, that'd be great. Okay, first I'm going to note any surgical scars or use of medical equipment. I'm going to inspect my patient's neck for internal jugular pulsations. I'm going to note, and then I'm going to auscultate the four posts. And as I'm auscultating these four posts, I'm going to be noting rate, rhythm, S1 and S2 sounds, and any murmurs. So I'm going to start at the aortic post on the right second intercostal space, then the pulmonic post at the left second intercostal space, then the tricuspid post at the fifth and sixth left intercostal space, and then the mitral post at the fifth and sixth more lateral left intercostal space. I'm then going to assess my patient for carotid bruits. Okay, and then renal bruits. Okay. Following that, I'm going to inspect my patient's hands for any signs of Janeway lesions, Osler's nodes, splinter hemorrhaging, or clubbing of the fingernails. And then I'll inspect his lower limbs for signs of edema, any varicosities, or notable skin color changes. Okay. Then I'll proceed with my respiratory exam. I'm first going to assess that my patient has no signs of respiratory distress, such as nasal flaring or use of accessory muscles. I'm going to note that they don't use respiratory equipment. I'm going to check for the midline position of the trachea, and I'm going to assess their rate and rhythm and work of breathing. And then I will proceed to auscultate 4 posts anteriorly and 6 posts posteriorly, and ask my patient to go and breathe in at each post with his mouth open. Breathe in. Back and breathe in. I'll then proceed with whispered pectorality. I'm going to do the same posts and ask my patient to whisper 99 at each post. And then I'm going to proceed with bronchophony, where I'm going to ask them to say 99. 99. Back. Okay, and then lastly, egophony, where I'm going to ask him to say E. And then, no. Okay. If this stuff's going, we'll find out. Then I'm going to check for tactile parameters. I'm going to ask my patient to say 99 again at each of these posts.
99.
next, I'm going to go ahead and percuss each of those points. Following percussion, I'm going to go ahead and assess for symmetrical expansion of the thoracic cage. Go ahead and breathe in for me. Okay, and same thing again. Okay, and that concludes my respiratory exam. So then I'm going to start with my gastrointestinal exam. I'm going to ask my patient to go ahead and lay down in a supine position with his knees slightly flexed. You can scoot back a little bit if that's okay. Actually. Okay. Supine position with his knees slightly flexed. I'm going to inspect his abdomen for noting any the skin color, any scars, distension, stomas, or other abnormalities. I'm going to assess. Then I'm going to go ahead and auscultate each of the four hosts for vowel sounds, or each of the four quadrants. And then I'm going to auscultate for renal bruits, and femoral bruits. Okay, and then I'm going to go ahead and percuss each of the four quadrants. Okay, I'm going to go ahead and ask my patient if he has any abdominal pain. No, okay. I'm going to go ahead and begin palpating his abdomen, starting light, then going deep, and if he had any pain, I would have been starting away from that pain at first. Okay. I'm going to go deep. Okay. Following that, I'm going to go ahead and complete several tests on my patient. I'm going to start with the rebound tenderness test. Tell me if you have any pain after I remove my hand. And that can test for peritonitis or appendicitis. I'm going to go ahead and complete the, I'm going to ask him if he has any tenderness at McBurney's point. Do you have any pain right about here? No? Okay. I'm going to complete Robsing sign, where I'm going to press down on his left lower quadrant, and let me know if you have any pain in your right lower quadrant with this. Nope. Okay. I'm going to complete Murphy's sign then, in the upper quadrant. Go ahead and breathe in deep as I do this, okay? Okay. Alright, and no pain with that? Okay. That was my Murphy sign. I'm gonna do my psoas sign test. I'm gonna ask my patient to go and lift his leg and push against my hand as I push down. Do you have any pain in your stomach? Okay, good. And then I'm going to ask my patient to go ahead and rotate on his other side, if that's okay. Go ahead, and I'm going to go ahead and pull back his leg stabilizing his hip here. There we go. Any pain?
No.
Nope. Okay. Go ahead and lay back on your back again. I'm going to perform the obturator sign, which here. So go ahead and lift your leg. I'm going to push in. Any pain with any of that? Okay. And then the fluid wave test, where I percuss. Actually, I'm going to do this hand. And I'm not noticing any fluid wave. So that completes Osce 1. Hopefully that wasn't horrible.